Hi, I'm Sean. Thanks for watching. The intention of this video is to talk about the different levels of care that some of us might not be familiar with when we talk about our mental health. So the different levels of care, and then we'll dive into each of them to talk about them a little bit more in detail. But just to outline it, the different levels of care are hospitalization, RTC, which is a residential treatment center. Then it's PHP, which is a partial hospitalization. And then we engage in an IOP, or sometimes it's labeled just an OP. It's an intensive outpatient program. And then the next level is what we commonly might be more exposed to, which is individual therapy. So each of these levels, there's a pattern, there's a theme that copy and paste throughout it, but each of them do provide a unique difference as well. So we have an RTC. Before that, we have hospitalization, we have a PHP, we have an IOP, then we have individual therapy. Let's explore a little bit about what each one kind of does. In a hospitalization setting, this is the most intensive of the cares. You are in a hospital voluntarily or involuntarily. And typically what placed us in the hospital is what we call not being able to keep ourselves safe or others. So sometimes this happens when we're bipolar and we've missed our medications and we might have a manic episode. Sometimes this happens when we have accidentally or intentionally overdosed on some sort of medication or some sort of substance, or this has happened in an attempt that we've had where we can't keep ourselves safe. So either way, you enter the hospital, either voluntarily or involuntary. The goal of the hospital is to stabilize you. There's sometimes other goals too, which is maybe if it's your first time there, to find a diagnosis, meaning what's kind of going on with you. So they might take some blood work, they might do some other things, but the goal of there is to stabilize you, either by getting you back on medications or the medication that may work, and or detoxing your system from what might be affecting you and happening to you. We're typically there, it varies, this isn't like the golden rule of thumb, but we're typically there for about 2 or 3 days, but sometimes depending on the hospital, we might be there for a week or maybe a little bit longer. If we're able to be there a little bit longer, basically their goal is to stabilize us, find a diagnosis, do some blood work, figure out kind of what's going on. And until we can keep ourselves safe or we have somebody kind of supervising us or whatever it may be, they're going to kind of keep us there. Or if you also don't feel safe and you voluntarily check yourself in. So that is a hospitalization setting. Now let's explore the next level down from that. That is what we call a RTC. It's a residential treatment center. So when you're in the hospital setting, you're away from a lot of your, well, hopefully, you're away from a lot of your stressors. Whatever the stressors might be, they picked you up and they took you out of the bowl and they put you somewhere else. So you're away from family, from friends, from work, from school, whatever it may be, you're away from those things and you're in a controlled environment where they can monitor you. And RTC looks at that and goes, instead of taking somebody and dipping them into ice cold water or burning hot water, instead, let's gradually get them back so we can figure out, get them the tools they need so we don't shock their system and get them from a hospital right back to their stressors. So an RTC is where we go to after hospitalization and we're living there. We're living in a house. Sometimes it varies depending on if it's for substance use, depending on if it's for eating disorders, or depending on if it's for mental health, or sometimes all of it. But we're typically there with, let's say, 5 other people, so 6 people in total in the house. You're constantly being monitored. You do have some freedoms, but pretty much you have a routine you got to stick to, and that routine can consist of varying things. But in there's medication management, there's individual therapy, there's group therapy, sometimes there's equine arts, music therapy. Sometimes they also add different types of therapy, neurofeedback, EMDR, whatever it may be. But you're basically from a hospital setting, you're going somewhere and you're living there as well. So you can be there for anywhere from, it depends, 30, 60, sometimes 90 days, depending on multiple factors, but your engagement, insurance, and so forth. So after hospitalization, it's what we call an RTC, Residential Treatment Center. And there, you get a diagnosis, medication management, individual therapy, group therapy, and you continue from there, slowly adding quote unquote stressors to kind of build the weight up, to get that foundation going, to make you a little bit stronger. After the RTC, Residential Treatment Center, the next step down after that is what we call a PHP. It's a partial hospitalization. So the main difference between a residential and a PHP is that in the PHP setting, you're back. You're back at home. You're back in your living situation, but you are treating your mental health like a full-time job. So even though you're back in your environment, remember, we're slowly introducing stressors back into our lives. We're still going somewhere and going like a full-time job, 9 to 5 for our therapy, which means medication management, sometimes individual therapy, family therapy, group therapy. Each program may vary, but pretty much you can see the themes of keeping therapy, medication management consistent as we are adding more weight to ourselves in our, let's just say, weight training process. But hospitalization, RTC, and then PHP. You're in a PHP setting, again, it depends, it varies, but you're in that program for a little bit longer than you were at residential possibly. But let's just call it about 30, 40, 45 days, something like that. Now, after the PHP setting, partial hospitalization, where you're living back at home and treating mental health like a full-time gig, like a full-time job, the next level down from that is IOP, or sometimes referred to as OP. It's an intensive outpatient program. So in this intensive outpatient program, medication management, therapy. And now what we're doing is we're treating our mental health like a part-time job. If we weren't going to school, if we were working part-time, now we're starting to work full-time, we're back engaged on the school campus, whatever it may be, but we're adding the stressors back into our lives and coping with them with the skills and tools that we've learned throughout our gradual programming. So in an IOP or an OP setting, we're there part-time and you're in that program. It depends, again, talk to your therapist, talk to your insurance company, talk to the programs, but you're basically there for about 45 days, sometimes maybe 60. But yes, that's an IOP program. After the IOP or the OP program, now you get into what we kind of maybe are more familiar with, which is individual therapy. Individual therapy, you might go into someone's office, or nowadays it might be virtual, and you see them once a week for 50 minutes, or you can see them twice a week, whatever it may be, but pretty much, hopefully, talk to your psychiatrist and so forth, talk to your physician, but we're kind of maintaining the medications as well as doing therapy. So you can see on each level of these, we're being consistent with medications and we're being consistent with therapy. The level of therapy, the level of medication might be a little bit more intensive or whatever it might be, but it's consistent as a common thread as we're introducing the work, school, family, partners, whatever it may be, these other kind of stressors into our lives. So just add a little bit to simplify this process and so forth. And I'll put up a little bit of a little screen for us and stuff. But when we are talking about mental health, we can imagine it sometimes like a diamond. Where in that diamond, we have insight, so a knowingness or a want to change something. We are aware that something's going on. Then on the sides of the diamond, we have what we call our social support. So the people around us that can either help or sometimes be obstacles in that change. And then we have our environment. We all actually have triggers to certain environments we're around. So you have an awareness that you want to change something, who's around you and what's around you. Then at the bottom of the diamond, we have our rewards or the intention or the purpose of the change. So a lot of times in our lives, it's okay, it happens. But if you look at that diamond and shift to the side, it almost can look like, let's just call it a car with all four wheels. If those four wheels aren't touching the ground, sometimes we can get stuck. So if I have insight and I know I want to change something, but my environment and the people around me don't line up with it, I'm off the ground. One wheel or two wheels might be touching the ground, but it's still not getting enough traction for forward moving progress. So that's why at times, sometimes even having too much insight into something can feel heavy. And that's where we go and we get some help. There's nothing wrong with asking for help. This video was an overall general statement. There's a much more fine little details to it, but I just wanted to give a little overview of the different levels of care, just so we are aware that between hospitalization and individual therapy, there are other levels of care that we can participate in that kind of help us. Again, thanks for watching. If you liked the video, thanks.